CAPER Young Investigator group. This will be recorded so folks can listen to this online, and of course, learn more about the Young Investigator group on our website as well. As you're probably aware, one of the main focuses of CAPER is about pancreas education. And one of the ways that the Young Investigator group tries to achieve that is by bringing successful young investigators into a forum where we can, in a casual, sort of informal environment, we can ask a number of questions and sort of pick each other's brains and try to develop a community of younger clinicians and researchers with a shared interest in the pancreas, and hopefully learn from one another, collaborate at times if it's feasible, and help to build the field, particularly from the younger age as we're finishing training and moving forward. So the way this fits in today is we have Kelly and Yanan, who are recognized as exceptional because they're giving oral presentations at Pancreas Fest in the sort of the young investigator session we have there. And what I hope to do today is to ask you both a number of questions about really the logistics of how you got involved in research, maybe some questions about why you got involved in research, and then really to drill down on some of the specifics about finding a mentor, working with a mentor, doing data collection in Excel, in some kind of things like that, that maybe some residents or fellows or even junior faculty may have never done before. And so if you've never been really closely mentored through a project, it can be daunting to think about starting. So hopefully we can demystify that a little bit. We've had previous sessions about how to ask a good research question. So I'm hoping that this will build upon that previous session. And once you have a good question, what does that look like in terms of putting it into practice? So I'll start out with Yanan. If you don't mind, tell us a little bit about yourself and maybe where you're at in training or in junior faculty, and a little bit about the project that you'll be speaking on at Pancreas Fest.
Yeah. Hi, everyone. My name is Inan. I'm currently a last year pediatric GI fellow at the Children's Hospital Los Angeles. So I actually joined the CAPER program since the end of my first year of my fellowship, beginning second year of my fellowship. So I have been in this program for 2 years with the help of my own mentor and my mentor in CAPER program. We both together finished this project and previously presented in the CAPER meeting, and then going to be presenting the CAPER in the Pancreas Fest. So what's your the other question?
No, that's perfect. And you're a pediatric gastroenterologist
yes,
with an interest in the pancreas.
Yeah.
And as you're coming into your third year of your last year of fellowship, do you have
actually I'm mostly done with my third year.
Oh, okay. And now where will you be in a couple of weeks?
I'm going to be as a more like a private practice. Yeah.
Awesome. And Kelly, do you mind telling us about kind of where you are now and where the project came from?
Yeah, absolutely. So I am a soon-to-be PGY 7 general surgery resident. My course is a little bit different. I did 3 years clinical, and then as part of our training, we do 2 years of dedicated academic development time after 3 years of clinical, but I chose to take a third year. So I've been with CAPER now nearly 2.5 years and have presented at 2 of the CAPER meetings. As far as future plans, the goal is to go into surgical oncology with a focus in HPB.
Great. And if I remember, you're in Florida, so you've been working with Steve.
Sorry, University of Florida.
Right.
I'm in Dr. Hughes's lab currently.
And I guess, is he also your CAPER mentor, or
no?
are you paired up with someone else through the scholars program?
Yes. So, and that's been great. Dr. Yadav is my CAPER scholar mentor.
Awesome. Great. And Yanan, I didn't catch the name of your mentor through the scholars program.
The one that on my program is Dr. Yuhua Zhang, and the one in CAPER program is Dr. Abu Haija, yeah.
Abu Al-Haija, yep, that's a hard one to say. And she's
Yeah.
also a pediatric gastroenterologist
Correct. Yeah.
from the University of Cincinnati. So great. Do you mind me asking about your local mentors? Can you tell me how you found them? Was that you had kind of rotated on service with them or sought them out via email? Kelly, do you want to go ahead and start first?
Yeah, sure. I laugh because I first met Dr. Hughes on my second rotation as a third-year medical student. I was very lost. And thankfully, he was very understanding and kind of took me under his wing. And then I rotated on his service as a sub-I, and then stuck around for residency and knew that I wanted to go into surgical oncology, and his lab has been fantastic. So it was kind of like an easy fit there. And yeah, so that's how Dr. Hughes originally became my mentor as part of that dedicated.
And it sounds like you ran into him you were a very malleable
Yes,
medical student. So
I was going to be a pediatrician. So I, at that point in my life, had no interest in surgery and then kind of fell in love with it.
And do you feel, and I'm maybe speaking from my experience, I always thought I was going to do IBD until I met a great pancreas mentor. And that kind of steered me into the area of IBD. So do you feel that you found a mentor in a space and it's sort of that mentoring relationship that brought you along the way? Or was it you knew where you wanted to go and you found a mentor to get you there?
I would say that I have always been interested in kind of the pathology and I'm sorry, that's my son, he's a year old.
That's okay.
If you hear crying, it's not me.
Oh.
But I've always been interested in oncology, and originally I was thinking like pediatric oncology. I would rotate in oncology clinics, and then when I really saw the surgical oncology piece of it, that's where I started to first become interested in it. And then Dr. Hughes really, he puts a different kind of spin on it, in that he is a great example of somebody who is able to run a full research career as well as take really good care of his patients. So I think that seeing him as an example, more than anything, is what motivated me to go towards surgical oncology specifically. And, working with pancreatic cancer patients is particularly special. So that's another motivating factor.
Great. Yanan, when did you meet your local mentor?
I met her during my first year fellowship. I did, a rotation with her, but choosing her as a mentor, I think, is more towards the end of my first year, when I really think what I'm going to do to finish as my fellowship project. More so, at that time I'm just thinking of trying something different, because everyone say, oh, I want to do IBD. Everyone say, oh, I like EOE or celiac disease, or those kind of main thing that people are likely focusing on. Of course, that everyone have different opinions, but I think when I choosing a project at that time, I really want to try something different, and the second is that I want something that I can finish within the 3 years during my fellowship. Because if I choose IBD, I know there's many projects working that is progressing, and so many people devote so much in this field. I'm personally, as a fellow, I don't think I can be a main person if I want to do something big, or if I want to do something small in this field. Probably it just won't be even published well, or if you do something that is well researched about. So that's why I want to, at that time when I choose my research project, I want to just try something that not so many people are like actively doing, though there are still many people, but not that popular in general. So my mentor is actually a pretty young faculty. She built this pancreas program in our hospital, in our center. She actually was mentored by Dr. Abu Al-Haja at some point. You know, Abu Al-Haja, she was like in pediatric pancreas, she was the one that published majority of the guidelines for the pediatrics. So my mentor was mentored by her at some point, and she currently building this kind of a newly program, and she's actively building it. I think, I may be able to join this and actively participating in something that I really able to do something and make it done in 3 years. So that's how I choose this. And then the more I choose it, the more I find it's pretty interesting, actually.
Yeah, you bring up a number of great points. The first of which is that pancreas is a really, I feel, a very welcoming space for research, and it's a relatively young field or an underdeveloped field so far.
Yeah.
So
correct.
even some, even if you're looking to do a very feasible project, even something like a retrospective chart review, there are opportunities to really expand our knowledge in the pancreas field, just because there's so much that we don't know.
Yeah, I totally agree, because there's so much, so easy that you can find, we don't have data for this thing. We don't have data for that. There's so many things that we don't have data about. So it's really easy to look into something.
Yep. I also like that you mentioned that your mentor is relatively junior faculty as well. And that we'll hear what Kelly thinks about Steve being a more wizened or a more seasoned mentor. But I feel there's some benefits in, my mentor was very young. He was 1 or 2 years out of fellowship. And I feel at that time, they have a lot of big ideas and can say, like, here's an idea for you. I don't have the bandwidth to do it. Run with it. And then you can really develop that idea, and they give you more guidance rather than maybe direct. I don't know if you ever felt micromanaged, for example, or if you were kind of left to go in your own direction.
I think a majority of time I can form my own opinions, get ideas going. I think it's very easy, because it's really easy to talk to someone that is also not too far away from fellowship, and also actively doing some project as well.
Yeah, so because they're young and there's maybe not that power hierarchy or that struggle, they're very close to our age, and so it's very easy to talk to them about a project and not feel I don't know, this big difference in opinions and things like that. Kelly, since you have Dr. Hughes, who's been doing this, he's young and energetic, so I don't mean to say he's old in any ways if he listens to this recording, but he's certainly more experienced and has had a number of mentees over the years. Do you talk to me about how you view that being, better or worse, say, than having a very junior mentor?
I think that it's been great. I would say the approach that Dr. Hughes always takes, and I've heard him say this a couple times, is that when you start in the lab, he says, we have this garden, and this garden has been going on for, I've been here for 11 years. And this is like our research garden that's well established. You have that to start with right off the bat. You can start with projects. But he always says that he wants you to start your own garden as part of the community garden. So that was an interesting take, I think, because he has the experience. I could come into it and kind of try to hit the ground running, as in the space that they have already created. But I also had research questions of my own that I could allow to flourish as I went into the lab. For me, it took place as like a prospective study over the 3 years. But while I waited for that data to accumulate, I was able to use the existing data. And I will say that one of the perks of having an established mentor is, in our case, access to the tissue bank, which I think that you can also get with a newer faculty. as long as that's part of the institution or someone you're collaborating with. Certainly in the pancreas world, I feel like there's plenty of collaborations that you can get specimen from.
I really like that image of a lab as a community garden, and the mentor kind of oversees it all, but you got your own row.
Yes.
But at the same time, there are shared resources that the mentor can oversee, and there may be, one of the previous folks graduated from the garden, but there may be some tending that needs to be done on their old row. So there may be opportunities for you to step in and finish a project, and now you've cleared space for your own project.
Exactly.
Whereas maybe younger mentors, everything's starting fresh, which can be exciting, but then there may be more groundwork for you to do to build it. So when you get to discussing that feasibility, a project that's half done is much more feasible to do in a year than one starting from scratch.
Certainly.
So I'll go back to Yanan. Once you met with your mentor and you said, I really want a feasible project that I can finish in my 3-year fellowship, what was the next step? Were you able to kind of say, I want to focus on this specific topic or this specific question, or did your mentor have an idea and they kind of passed it on to you?
So yeah, so initially she gave me a list of the things that she's thinking about, as probably many of these, mentors, or they have something in their mind, and they just don't have time to do it, and they have a kind of a list of their thoughts. So she gave me a list. She gave me some, new published guidelines to read. I didn't really use the list that she gave me. As I said, that there's so much to do in pancreas field. When you read one guideline, they will say, oh, we are not clear of what. We don't have enough data of what. So it's so easy when you just read one guideline, you have something came into your mind. So that's what happened to me, that she gave me a list that while I'm actively thinking the things in her mind, I'm also reading the guidelines she gave me. And I think then I combine a lot of things. I kind of starting to have my own thoughts. Oh, I'm really, these things we don't have data about. Some people did this part, but there's a gap between what and what. Then I think I want to fill that gap. So that's how my idea came from. For example, there's no standard endoscopy pancreatic function test in pediatrics. Not until very recently, there's a position paper posted a recommended procedure, recommended protocol. When my mentor, as I mentioned, she's new and she's building this pancreas program, and she's starting to do this EPFT since 2018, and she built this whole protocol. And at that time, I was thinking, okay, how about other programs? Not many programs in pediatric center do EPFT. If we want to more accurately analyze the exocrine pancreatic function, what our thoughts, what else we can do in those situations. So I read some guidelines regarding this, and I found there's a lot of gap here and there. So I started my project in exocrine pancreatic insufficiency, and all my data is kind of I starting to collect in patient, and then I get my data and I get my results.
That's awesome. So it sounds like she gave you some initial direction, and as you explored that, you found within that a very specific question that aligned with your interests, and also helped to build the, what you were seeing as a fellow when you were evaluating these patients. It's like, I really want to offer EPFTs at our institution, but I want to offer the right one. And so there's almost I imagine you felt the need to build it, which really drove you into researching it and understanding what's the best way to do this for patients.
Right. So basically, my research is about try to, there's no one best test for the exocrine pancreas function. And I want to compare different test results, and then to see if we can using them in a well-rounded way to look at them and see if we can get a better understanding. Even one test there's no single test. How about if we look at them in a whole, if we can have a better prediction of this patient functions. So that's my interest. And then I discuss with my mentors. This is a good part for, I don't know, for Dr. Hugh, but this is, I think, for young faculties that I have unlimited access to her that, hey, you're here, let's talk about, can you tell me about this? Can we discuss about this? So every time, almost every day, because young faculty have so much clinical work, so she's here every day. I can easily walk to her office, say, oh, can we discuss a little bit this? So it's so easy. So we can kind of discuss this at the initial phase. We discuss every single day, then fine tune the project, because one topic may be too much. If we want to really do it, we want to make it more feasible. So kind of more fine tune it, then make it a project that is more feasible to do.
And as you were kind of turning around within the theme of exocrine pancreatic function and objective testing, when you were sort of brainstorming, okay, how do I make a testable hypothesis, or how do I really identify groups to compare? Were you brainstorming those with your mentor, or?
Yeah, we do. Yes. So at the initial phase, when we try to discuss the research project, every single time I discuss with her.
Yeah, yeah. And that way she was able to really help you refine your thinking, guide it into a very specific question, and then develop a way to test that question. So
yes. Yeah.
Great. Kelly, was that a similar way that you worked with Dr. Hughes, or was it, sounds like maybe you came up with the project and brought it to him?
In a sense. So he and the lab in general had a data set in a sense. So we had MRNs, and then we had, probably like just diagnosis next to it. So I knew that I had access to things in the lab. And it was kind of like, here you go. Here, like, you can kind of make a question out of this, or like, if you have a question, here is a way to answer it. Dr. Hughes being clinically busy, we had a lot of conversations, I would say, like on the fly. So like walking, driving, certain things like that. Of course, we have our weekly lab meeting, and then we meet for our surgical oncology, like research meeting. So I do see him at least twice a week for an hour at a time. But those were the times more that we like ironed out like the nitty gritty, like Dr. Hughes, these are the data. What do you think? Like, why are our results counterintuitive? And so that was helpful. But a lot of it was kind of coming up with a question and how to answer it.
And it sounds like he was able to remind you or equip you with, these are the tools we have available.
Yes.
How can you refine that question in a way that our tools can be used to answer it?
Yeah, and for me, I really went into the lab with very minimal basic science background. I mean, aside from some biology labs in college and a couple retrospective chart reviews, my research experience had been like minimal going into residency. And so he really helped me figure out, like, okay, you have this question. These are the tests that you can do. This is what's available to answer this question. And a lot of the times I hadn't even thought of like a certain way to get at looking at the data. So that was very helpful.
Yeah. And I'll ask you the same as I asked Yanan, when you were kind of tossing questions around within a theme, and trying to brainstorm. Were you doing those with Dr. Hughes or with your co-fellows, or kind of who did you brainstorm with?
I would say both.
Both.
When we started, it was certainly Dr. Hughes. And then once I got some data back, then it was more my my co-resident, Andrea, was in the lab with me, who was also a pancreas scholar.
Mhm.
She'll also be presenting, but her and I would even just like go out to lunch and talk about our research topics and how we want to tackle them, and, you know, a way that we can work together with our shared data sets. And so that was also extremely helpful in the lab to have her there.
And then and is she working in a related space? I guess it's the same garden, so it can't be so dissimilar.
Yes. So she is, so
I'll just say she had a conflict tonight. We had invited her.
she is working trauma tonight, unfortunately. Yeah, I'm sure would much rather be here than being the trauma chief.
Yep.
But yeah, so her research for CAPER is more so geared toward cachexia, and looking at how the tumors themselves influence cachexia. Whereas my research was focused on the tumor microenvironment. So in a sense, they did overlap. So looking at certain cytokines that may be involved in cachexia, that we are seeing in the tumor microenvironment. So, and she has access to something called slice-o-matic data, which I know Dr. George has some experience with as well. But we were able to kind of overlap our data sets in some of our projects, which was good.
And the reason I asked that is from my personal experience. One of my co-fellows, we were co-residents together, and maybe it's a similar experience as you and Andrea, having been in the same training program for 5, 6, 7 years.
A long time.
Get to know someone very well, and particularly when your interests are close enough to be complementary, but far enough apart that they're not competing in any way. It can make for a really nice way to brainstorm socially, over lunch, over dinner, whatever. And I find that makes developing a research idea a little bit more fun.
Yeah.
And can really be engaging. So.
Yeah. And, you know, the questions that you don't necessarily want to bother your boss with, or you think something's a dumb question, it's always easier to talk to one of your good friends about it, versus talking to Dr. Hughes while he's operating or something like that.
Right, so. Right. No, I totally agree. And then once you've either brainstormed with your mentor or brainstormed with your buddy, you can go back to your mentor and say like, okay, I've thought about the question. Right. This is what I want to ask. And this is, you know, I think the main comparison groups, or how I want to address the question. Yanan, I'll go back to you with your project, thinking about exocrine pancreatic function. Once you had a clear sense of what question you were going to answer, what was the first step you had to do to get started? Was it a IRB? Was it build an Excel spreadsheet? Where did you start?
I think it's so it's kind of you start everything the same time. You will write a proposal first, because you know it's for both IRB and both for what you really want to do. And when you write the proposal, you really know what you want to look for, what's the background that is listed there. Writing a proposal at the beginning makes things easier when you write the manuscript as well. Also make yourself better known what is well studied, what is lacking, so that when you write the background, you know that part, and then you set your aim, and then you will know, okay, this is the data I want. So you build your Excel sheet, and you want to collect this, and then you submit to IRB. So I think it's you do all these things simultaneously while you are forming your idea. and you're writing your proposal.
Yep. And as you were developing the proposal, you would probably go back and forth with your mentor about, I'm trying really, now that I'm into it, I'm refining my aims. What do you think about it this way?
Yeah.
And you do all of that before submitting to the IRB, before you collect any data. So you really have a concrete sense of this is what we want to do. Now we can go do it.
Correct, because IRB would specifically ask for certain things like, are you going to approach the patient? How you're going to handle the data? And are you doing, it's just a clinical research or there's a, bench research part? You have to make it clear to yourself before you submit to IRB. Otherwise, you will change your, or do you need to get a consent or not? There's a lot of things you have to think in advance before you submitting.
Yeah. And Kelly, was that a similar process for you on the sort of in the more basic side of things in the lab?
Yes, in the sense that it was more so the IRBs that we had to write, and the proposals were more so about data security and data sharing, versus because we already had our tissue bank IRB approved, which was one of the things that was nice going into the lab.
Yeah.
But yeah, I would say writing a proposal always is very helpful to try to get your words down on paper. And then I have a tendency of when I start a project, I like go more and more off to different things that interest me about the project. And then coming back to my proposal, I'm like, okay, yes, we got to stay focused on these parts of it. But
and I particularly like what Yanan said about the proposal really, as you're writing it, it's almost the foundation or the introduction to your eventual manuscript.
Yeah.
And so it kind of makes you, it puts the walls around the project. It says like, I could do, and I could do, but I'm only going to limit to these 3 things. And that's probably all that's going to fit into a 3,000 word manuscript anyways at the end. So once you've decided your protocol and you have your proposal submitted, IRB's all approved. What was the next step in your project, Kelly? Was it to go back to the specimens and start, what did data collection concretely look like?
Data collection was arduous. I would say that I first went through and spent a lot of time in patient charts, pulling out all the data that I thought I would need, and kind of simultaneously doing like the processing of the tissue. And that was a learning curve, certainly. The first time I did a Luminex assay, I was trying to figure out how to lyse the red blood cells that had gotten incorporated into it. And those were just things that I hadn't even thought to even consider before doing basic science. So it was a lot of trial and error. So I would say as I did that, I at least was a little bit more comfortable going through and finding the clinical details about patients. And then that allowed me to, once I collected that, do my analysis pretty quickly once I had the data.
Yeah.
back.
So the hardest part was the clinical work. We've been clinicians for years, so extracting that data was not
Right.
time consuming, but it wasn't maybe mentally, or it wasn't quite as demanding. Whereas the lab work sounds like pretty new, and they were new techniques, and it was all. How much did your, I guess, other people in the lab, or did you go to your mentor with some of those things?
We have a PhD, Song Han, who works in our lab, and she was certainly helpful when I was trying to learn how to pipette and pulling out all my hair, trying to figure out how to run certain tests. But I went to her with a lot of the basic science questions, and then once we got that data, I went to our statistician for help a lot. And I would say that was one thing that was probably most challenging for me was I'm used to, if I try really hard at something, I should be able to figure it out and do it. But relying on other people to help me with certain aspects of my research was a learning curve in the lab.
Yeah. And I mean, a lot of people talk about team science, but especially as you get further and further along into your research skills, you recognize that, oh, I'm very good at, say, pipetting, or I'm very good at the clinical side, asking a good question, pulling in the clinical data. But as a result, I'm not so good at the other things. And it can be challenging either if kind of those complementary skills aren't available, or if it's kind of hard to speak their language because they're outside your silo.
Right. And I would actually say that is probably, so I, after waiting for people to help me with the stats, I actually went and pursued my master's in biomedical informatics to try. And everyone asked me like, oh, are you going to do all of your own stats now? And I'm like, probably not. But now I can speak the language to someone who is the expert in data science when we're talking about sequencing data or these massive clinical data sets. I theoretically could sit down and try to like chew through them, but for the people who speak that language, it allows me to at least communicate the clinical questions. So I would say that was certainly something I learned along the way.
Yeah. And so you broaden your horizons, but even now that you're there, you still you get to choose the things that bring you the most meaning, which might be doing more papers.
Right.
And the way that you can do that is you delegate and you have partners who do the things that are time intensive but may take you away from kind of your primary focus. So hope that doesn't sound bad about statisticians, but I think it is very complementary. I have one that I like that I've been working with for years, and we speak each other's language and trust that, you know, the other person is very, very type A. And so when I send something to her, she knows, okay, it's all been double and triple checked.
Right.
We can lock the data set.
Yeah.
So I think building those collaborations is very meaningful. Yanan, what did data collection look like for your project?
So mine is basically a clinical research. So there's no bench work, but more so a prospective research. So all I need is that, you know, the patient coming, I get the data I need, kind of that thing. So I think the hardest part is that, you know, there are some data missing. For example, you need these labs because it's a prospective study. I order labs for the patient. It takes them forever to get it. I order imaging for this patient. They, you know, takes forever to get it. So some data may be missing.
Yeah.
I think eventually I did. So I think that's why I think the most important thing when you do your project is really set a very good aims. And it's not just one aim. You want to really think of 3 or 4 or 5 aims, so that if some data are missing, that one aim that you cannot achieve, you can still achieve some of them. What I'm thinking of this is that here's a main thing that I'm really interested in, that I want to fill the gap. So these are the data I really need. From the data, what else I can get from the data? I can get my second aim from the same amount of data. I can get my third aim from the same amount of data. So while I'm collecting this data, I can fill some other gaps as well. Or this gap, this probably aim still related, but there may be some difference with each others. So if there's data are missing and you cannot get all done, you can still, you know, fulfill at least 1 or 2 or 3 aims in your project.
That's a really great point, and probably that's the next level. You know, I have an idea, how can I tag on some extra ideas that are minimal additional work while you're going through all of these charts or while you're seeing all these patients. And I imagine for, especially for folks who may be earlier in their training rather than, as a finished product GI fellow, they may not know, what's a related question to this. And so that's something that a mentor or maybe a more senior colleague could help come up with. Oh, if you're collecting CAT scans, why don't you also look at MRIs, just in case there's no CAT scan available, for example. Can you talk a little bit about what it looked like to then analyze that data? Was it something that you were doing personally, or did you have a collaborator as well?
I actually did the majority of the data analysis myself. It's not that hard because when I initially designed the project, I know what kind of things I want to compare. For example, okay, I'm compare the means. I know what to do. I'm going to use a cross table. I'm going to use chi-square test. Things like that. At the beginning, you will know. That's why still, when you're setting the aims, you will know what you're going to compare with. With the data, you can pretend you already, these are the data you collected and how I'm going to compare them, what's the ways to connect them. When you read the proposal, that's part of, will also be in the proposal as well. So how you're going to compare and what you're going to get from this comparison. So at the beginning, I find that majority of, the data analysis can be done by myself. In addition, is that in our institution, we only have one free session with statisticians. So it's not so feasible to always, reaching out because especially for a prospective study, there's R data that keep coming.
Yeah.
Unless you really work with your with someone that has a hired a statistician that is always available, that you can have unlimited access. Otherwise, whenever you add one more data, while you are writing something and there's one more data coming and you want to include them, you will have to redo everything again, which is not always feasible.
Yeah. So tell me a little bit more. So I've been working with our division has a statistician that's full-time for the pancreas group. And so as long as it's a pancreas project, I can work with her, and I've enjoyed that. But you pointed out already one thing: when you're doing your own data, as the data becomes updated, you can personally go in and just rerun the SAS or the stat, whatever you're doing. Yeah. Can you tell me a few other sort of benefits that you've experienced of doing your own data analysis? Maybe another one is, because you know what the data has to look like to analyze it, I bet you're better than most at collecting the data in an organized way and in maybe columns or in rows that you can analyze it at the end. Other benefits to doing your own data analysis?
I think it's just easier. For example, how you're going to use the, for example, there's one data is missing. How are you going to dealing with them? Are you going to delete this patient from analysis, or are you going to just this one thing you probably will not include this patient, but the other things you will include this patient. So you all these small details you have to let your statistician know before they run the data, because all you give to her is a list, it's a Excel, and she's going to run with the program. But going into every single column, maybe you have different requests. For example, this column, I want to ignore these two patients because they didn't do something, because they are sick when they doing this. So there's a some small things that you probably want to think of, but you have to let your statistician know when they run the data. But if I'm doing it myself, I know this, and I can always redo my data, or if I feel that okay, this data does something that is very bizarre, and for example, one lab value is crazily different from the rest of people, and I don't think I should include this patient for this and this reasons, then after I see it, I probably want to delete this patient and then I need to go back to my data set and to rerun the data because I delete one patient for certain reasons, and those patients should not be included from your inclusion criteria, or maybe you will modify because of you find something that you want to exclude, you will add to your exclusion criteria. So in those cases, there's many small things that you have to redo your data, and while you are knowing how to do it, it will be much easier.
Yeah, and at the end of the project, you know that you've personally touched every aspect of it, from the proposal to the collection to the analysis.
Correct. Yeah,
and you can take full responsibility, and you know that it's accurate because you've crunched it all.
correct.
Can you talk a little bit about balancing time in this, especially as a clinician, also you got to collect all the data, now you have to analyze the data. How does that kind of balance with your clinical work, or how do you manage to kind of find time to do it all? That's a hard question.
I think the good part for fellow is that we really have dedicated time for the research. Like for us, as a second year and third year, our half of time are considered as a research time. So you really have a kind of this dedicated time to do this. So that's how I able to finish it.
And you made the most of it. So you did data collection early, and then you go on clinical work, and then when you're back, it's time to analyze the data.
Yeah, I would say that that's why I'm also saying that you really want to find something that is feasible, like that I'm doing a prospective review, prospective study, and you really want to know during the period of time how many patients you can get. If you're going to get 200 patients, you may not be able to do it. I'm only able to get 30, 40 patients in 1 year. So I think I would be able to do it. If 30, 40 patients, and one patient takes me, let's say 5 hours, you're still able to manage it. But if you say you are doing a IBD, whatever prospective study, and every single day you have 10 new patients that you're going to include, that's probably impossible.
Yeah, that's a really good point too. Kelly, I'll ask you as well, and then we're almost wrapping up on time. You were also trying to balance the time between the collecting the clinical work, doing the lab analysis. How did you manage to balance that with your clinical responsibilities? Or were you, I guess you've stepped away from clinical work for this block of time?
Yeah, thankfully, my situation was probably a little bit different in the sense that I was really 100% research, or at least 95% research. We cover trauma every now and then, but that was my main focus. So I think the only thing that I had to balance was my coursework with research. So it really, I was provided a lot of time to focus on this. But I will say that now that I'm going back clinical in July, it is really nice to have. So right now I'm just collecting all my data so that I can kind of just do the analysis when I'm clinical, apart from a couple chart reviews, but nothing that would like force me to be in the lab.
Yeah. Awesome. Well, in the last couple of minutes before we wrap up, I'd like to ask you each about what advice you might have for maybe for medical students, residents, or fellows who are starting to get more involved in research. What advice would you have generally to someone like that? Yanan, I'll have you go first.
Yeah, I think, as I mentioned, the most important thing, I think starting a project is finding a good aim. The aim has to be very specific, what you want to look for, and think of the data you're going to collect. And with the data, what are the aims you can achieve? So with the same amount of data, you will not just achieve one aim, because you can, some other aims you will for sure able to find. So set several, just brainstorm, write down what are when you're reading a paper, just write down what are the gaps there. And you're starting to match them. Okay, this gap need this type of data, this gap need this type of data, this gap needs this type of data. Okay, I find that these 3 aims that I can use the same amount of data set that I'm going to collect, I'm able to achieve these 3 aims. So while you are reading something, just try to do things like that. And then you will be able to find what your aims are and what your data are. And then even something are missing or even some aims are falling off, you will still able to have a very feasible project to work on.
Yeah, that's great advice. Thank you.
Hmm.
Kelly, what advice do you have for folks who are starting research?
Well, I was going to say something very similar, to stay focused on your topic, and just really focus on what exists in literature and really where the gaps are. But just to add on to that, I think that collaboration is key in research. I think it's easy to get very siloed into what you're doing. But I think that CAPER is a great example of the collaborations that you can form. And really, I think that really helps get more data. And I really like that it's a multidisciplinary group. So that way you get very different perspectives on what you're trying to achieve and the research that you're doing. So always kind of, pick the brains of the people around you, because that has been where I've gotten like some of my best ideas.
Yeah. And that's a perfect transition for me to put a plug in for everyone to come to Pancreas Fest, particularly because it's such a small meeting. And as a result, you're like very close quarters. And there's no one there to talk to except for, I'm a gastroenterologist, so I talk to pediatric gastroenterologists or surgical oncologists. And you're right, when you ask the same question to folks who are in related but complementary fields, you get very different perspectives, and it can be really, really eye-opening for other ways to answer an aim or other ways that other tools that you might have to analyze the data. So the other plug I wanted to put in beyond Pancreas Fest was you were both products of the CAPER Scholars Program and had mentors through that. And I think that's a really nice way of, for example, if you have a younger mentor at your institution, the Scholars Program can pair you up with a more experienced mentor who may have other tools that are available or maybe other projects or ideas that they could get you involved with. And so I'm encouraged that you were both so successful in going through that project, that program. We had a number of applicants this year, and I'm hoping that we can get more and more as the years go on. So I think with that, we're just a couple minutes left. I don't see any questions in the chat, so I will probably wrap up there. If you have other questions about mentorship, feel free to shoot me a message either through the CAPER website or Mitchell Ramsey at osumc.edu, and I'd be happy to try and answer and try to troubleshoot if I can. But otherwise, if there's no other closing thoughts, then I suppose we can wrap up there. Thanks so much, Yanan and Kelly, for being with us and sharing your perspective this evening.